These were the three main exercises that we used to reduce swelling in this client's knee, reduce her pain, and reduce the size of that Baker cyst. But remember, this was very early stages and only represented about a quarter of a rehab plan to restore full pain-free movement. So step one was to pump the knee and get some gentle stretching through the back of the knee. So on our back, we had her point our toe in 3 different directions to get our shin moving really well, to get that fluid moving in the knee. So we point the toes initially back towards the head and go through a small bending and straightening motion of the knee for 5 reps. And then we do the same thing with the toes pointed back and towards her left shoulder for 5 reps. And then the same thing with the toes pointed back towards the right shoulder. So 15 reps in total here. Then directly after that, we had her do these supported calf raises on a towel where we were only lifting the heel 2 inches off the ground to get some gentle contraction through the calves, and we did 20 total reps here. Then we needed to get some gentle on and off contraction of the quads to shift that pressure from the joint and into the muscles, because that muscle, the quads, were completely switched off in her case. So in a seated position with the hips above the level of the knees, we're pushing through the feet into the ground, lifting the hips off just a few inches off that support, with some support in front from our hands as well, holding the hips off the block here for 3 to 5 seconds and then dropping back down again. And we did this for 20 total reps for 3 to 5 second holds each time, with as much assistance from the hands as needed. And then lastly, we finished off that circuit with 15 reps of the knee pumping exercise on her back again. And we had her repeat this circuit for 2 days on, and then a rest day where she only did the knee pumping exercise, and then 2 days on again with all the exercises, and then a rest day. So we repeated that 2 days on, 1 day off for a total of 2 weeks. Now, of course, your situation will be completely different, so it's recommended that you work with a rehab professional to ensure you're getting the right exercises for your unique case.